Hi everyone, I'm Sir July and for this slide sets, we will be discussing the methods of breaking the chain of infection. We have previously discussed the chain of infection, which outlines certain conditions that must be met in order for an infectious disease to be spread from person to person. If you have not watched that video, please do. As a review, the etiologic agent is the microorganism. The reservoir is where the microorganism naturally resides. The portal of exit is the route of leaving the reservoir. The mode of transmission refers to the method of transfer. The portal of entry is the manner of entry to the new host, and the susceptible host is any person at risk. Now, we will apply the concept of breaking the chain of infection to prevent the spread of an infectious disease. There are interventions that can break any of the six links that make up the chain of infection. At this point, I'll ask you, what is the easiest link to break in the chain of infection? The first links in the chain of infection, the etiologic agent and the reservoir, are interrupted by the use of antiseptics and disinfectants and by sterilization. So what is the difference between sterilization and disinfection? Sterilization destroys all microorganisms, including spores and viruses, while disinfection destroys pathogens other than spores. There are two types of disinfection, concurrent and terminal disinfection. Under concurrent disinfection, immediate disinfection of all contaminated articles and bodily discharges occur during the course of the illness. Under terminal disinfection, disinfection of the patient's units and all the articles used are done after the discharge, transfer, or death of the patient who was suffering from the contagious disease. In summary, concurrent disinfection occurs while the patient is still in the room, while in terminal disinfection, it occurs when the patient is no longer in the room. So under etiologic agent, we either kill all the microorganisms in a process known as sterilization, or we kill the pathogens in a process known as disinfection. Now, let us break the reservoir. Change dressings and bandages when they are soiled or wet. Moist dressings are ideal environments for microorganisms to grow and multiply. Assist clients to carry out appropriate skin and oral hygiene. Hygienic measures reduce the number of resident and transient microorganisms and the likelihood of infection. Dispose damp and soiled linens appropriately. Damp and soiled linens harbor more microorganisms than dry linens. Dispose feces and urine in appropriate receptacles. Urine, and feces in particular, contain many microorganisms. Ensure that all fluid containers such as bedside water jugs and suction and drainage bottles are covered or capped. Prolonged exposure increases the risk of contamination and promotes microbial growth. Empty suction and drainage bottles at the end of the shift or before they become full or according to agency policy. Drainage harbors microorganisms that, if left for a long period, proliferate and can be transmitted to others. Now, let us break the link portal of exit. Avoid talking, coughing, or sneezing over open wounds or sterile fields. These measures limit the number of microorganisms that escape from the respiratory tract. Also cover the mouth and nose when coughing and sneezing for the same rationale. Proper waste disposal also blocks the portal of exit. There is this sample question in which you're asking, the client is a chronic carrier of infection. To prevent the spread of infection to other clients or healthcare providers, the nurse emphasizes interventions that do which of the following. And the correct answer for that is to block the portal of exit from the reservoir. And this especially holds true because the patient is a chronic carrier of infection. At the start of this presentation, I asked you if you know which of the following links is the easiest to break. And the answer is actually the mode of transmission. Hand hygiene is an important means of controlling and preventing the transmission of microorganisms. Cleanse hands between client contacts, after touching body substances, and before performing invasive procedures or touching open wounds. Instruct clients and support people to cleanse hands before handling food or eating, after eliminating, and after touching infectious material. Use PPE when needed. There will be a separate discussion on the use of PPE. Breaking the mode of transmission also includes universal and transmission-based precautions. Now, let us enumerate the steps of breaking the chain of infection at the portal of entry level. Use aseptic technique for invasive procedures such as injections and catheterizations. Invasive procedures penetrate the body's natural protective barriers to microorganisms. Use sterile technique when exposing open wounds or handling dressings. Open wounds are vulnerable to microbial infection. Let us define two terms. Asepsis is the freedom from disease-causing microorganisms, while sepsis is the condition in which acute organ dysfunction occurs secondary to infection. So when we say that someone is septic, it means to say that that person has an overwhelming infection that has resulted to acute organ dysfunction. There are two types of asepsis. The first one is the medical asepsis, also known as the clean technique, and the other one is the surgical asepsis, also known as the sterile technique. Medical asepsis involves procedures and practices that reduce the number and transmission of pathogens. So the goal here is the exclusion of all pathogens. Surgical asepsis involves procedures and practices that render and keep objects and areas sterile. So the goal here is the exclusion of all microorganisms. So to consolidate the information, medical asepsis is also known as the clean technique because it only excludes pathogens. Surgical asepsis, on the other hand, is a sterile technique because it excludes all microorganisms and not only pathogens. In addition to aseptic and sterile technique, the use of puncture-resistant containers also breaks the chain of infection at the level of the portal of entry. Place used disposable needles in syringes in puncture-resistant containers for disposal. Injuries from needles contaminated by blood or body fluids from an infected client or courier are a primary cause of hepatitis B virus and human immunodeficiency virus transmission to healthcare workers. And finally, let us discuss how we could prevent the transmission of infection at the level of the susceptible host. Can we do this? Of course, I'm just kidding. Maintain integrity of skin and mucous membrane. Intact skin and mucous membrane protects against invasion by microorganisms. A balanced diet supplies proteins and vitamins necessary to build or maintain body tissues. In addition, certain immunizations may protect people against virulent infectious diseases. So let us summarize. As previously mentioned, there are interventions that can break any of the six links that make up the chain of infection. For the etiologic agent, we could do sterilization and disinfection. For the reservoir, we should change soiled and wet dressings and bandages, do appropriate skin and oral hygiene, practice appropriate disposal of damp and soiled linens, practice appropriate disposal of feces and urine in appropriate receptacles. We should cover all fluid containers and empty suction and drainage bottles. Avoiding talking, coughing, or sneezing over open wounds or sterile fields, and covering the mouth and nose when coughing and sneezing prevents transmission at the portal of exit level. Of the six links in the chain of infection, it is the mode of transmission that is easiest to break. We could do this by hand washing, using of PPE, and practicing universal and transmission-based precautions. For portal of entry, we could use aseptic technique or sterile technique and the use of puncture-resistant containers. And lastly, for the susceptible host, we maintain integrity of skin and mucous membrane and promote balanced diet and immunization. Pause this video, gather your thoughts, and when you are ready, let us have a practice test. Disinfection of patient's units and all articles used after the discharge, transfer, or death of the patient who was suffering from the contagious disease is A. Concurrent disinfection, or B. Terminal disinfection. You have 5 seconds. And the correct answer is B. Terminal disinfection. Covering the mouth and nose when coughing and sneezing breaks which link in the chain of infection. Is it A. Etiologic agent, B. Susceptible host, C. Portal of exit, or D. Portal of entry? You have 5 seconds. If you answered C, portal of exit, you are correct. Immunization helps to break which link in the chain of infection. Is it A, mode of transmission, B, susceptible host, C, portal of exit, or D, portal of entry? You have 5 seconds. The answer here is B, susceptible host. And for the final question, the destruction of all microorganisms, including spores and viruses, is referred to as A, disinfection, or B, sterilization. You have 5 seconds. And the correct answer is B, sterilization. If you got all four answers correctly, then you did a great job. If not, you can rewind this video and check for your answers. This ends the slide set for breaking the chain of infection. Please do not forget to subscribe to my YouTube channel, Memory Aid Nursing. Thank you.